On the healthcare overhaul, the costs and the benefits and so forth, that what happens is it's like squeezing a balloon. That as you squeeze on one side and try to increase benefits, you're going to also increase cost. You try to squeeze out the cost, it's going to pop out somewhere else, or the balloon's just going to pop, and then the whole thing will deflate. And that's what you've seen in programs like Oregon, every other state program that's run out of money. Well, the problem is that you don't pay for a lot of the health care you get because of the employer mandates and the employer coverage. We actually have, it sounds weird, but we have too much insurance. We don't pay for a lot of the care that we're getting. I like to think of it as going to a buffet. When you go to a buffet, you pay up front, and you walk in and you eat as much as you want until you're full. You go to a regular restaurant, you eat a lot less because you're actually paying for each dish. And I think that's one of the problems we have. And that's one of the problems you're really going to get with state-run healthcare, where everything's free. They start loading up the buffet with benefits and charge a lot, but you're going to eat a lot once you're in.
What are some of the problems you've seen there with the system Oregon has in place?
The big problem you have is just running out of money, where you shut down the system, kicking people off through what I call tricks, charging them co-payments, also not allowing new enrollments. And the other problem you get is once you get people on and you have certain covered services, people are going to take advantage of those services. The other big problem you get is people will drift in and out of the program as they need service. So if you have someone who's got who hurts themselves, they're going to go in, sign up for the service, get their arm fixed, and then go back out and come back in when they need it again. Saves them money, but it costs the state a lot of money.
Part of this panel that is discussing national health care, the reform efforts that are being made, but really to share the experience of the states that have done governmental health care, seen the failures, and don't want it to be repeated in the national level.
Well, tell me a little bit about some of the issues you saw there in Tennessee with their program.
Well, number one, I chuckle about, for example, the rush to get it done. We got ours done in 90 days, and that's what the Obama administration tried to do. It was done and it was underfunded from the start. I mean, we had enough funding for 760,000 people, and we added 400,000 at the same funding, so it was inadequately funded from the start. We had doctors who did not participate because the funding was so bad. We paid doctors 30 cents on the dollar and hospitals 60 cents on the dollar, so they were severely hurt financially. We had a category called uninsurables, where we brought people came from all over the country who were uninsurable elsewhere, came to Tennessee. The AIDS Network, for example, on the internet, told everybody how to come to Tennessee and get on TennCare, get their care taken care of. We had transplant people coming in. We had all sorts of abuses like that. We had, because it was for the poor, there was tremendous overutilization because the benefits were so rich. And that was one of the things that was discussed here today, is you could not buy a benefit plan with benefits as rich as we had in TennCare anywhere in the private market.
What is one example? What is one thing we should learn then from what Tennessee went through with their program?
Number one, this panel and people who are opposed to Obama are not opposed to reform. It's just that there are elements of reform that are necessary, but you don't change the whole system for those elements. For example, one of the things you're not hearing out of Washington, D.C. is anything about defensive medicine, tort reform. The Bible for Obama's plan is Tom Dasher's book called Critical. And in a 250-page book, the word lawyer never, ever appears. Tort reform does not appear. So there's a necessity for tort reform. We have a necessity for how do you get portability of insurance, that you can move from one job to another and keep that. And then how do we take care of pre-existing conditions so that people aren't turned down for insurance. So those are elements that absolutely need to be reformed, but you don't change the whole system that 80% of the people are happy with. The other thing you look at it is Obamacare doesn't talk about health care. Right? It's all about these other issues, insurance issues, things like this. They're not talking about the care issues. So until we get to the care issues, those are the things that need to be done as part of real health care reform.
Great. Thank you.